store with condoms, drugs and guns. The Guardian, endoftext. The most common form of cancerous cells is called an aggressive tumor. When these cancerous cells grow into a larger form, they can cause serious side effects that can be very serious for the patient. This is why doctors and nurses need to be aware of these types of cancer early in the treatment of patients who may need to stay in the hospital for a longer period of time than is recommended, especially for patients who are older and/or have more advanced stages of cancer. In addition, these patients should be aware of the risks that may arise from their use of certain medications. In the early stages of breast cancer or other forms of cancer, some of the drugs prescribed for patients are known to have side effects. These medications are called progestins. In these medications, certain hormones can trigger the formation of tumor cells, which then grow into more aggressive tumors. Progestins are used in some forms of cancer, such as in women who have certain genetic conditions or those with certain cancers in their family. However, these forms of cancer are not generally associated with the use of these medications. Some types of chemotherapy also can affect the development of certain cells. In addition, some drugs also can interact with certain proteins in the immune system, or with the body's natural defense against certain types of cancer. In the early stages of breast cancer or other forms of cancer, these drugs that are prescribed for patients have certain side effects. These drugs can also have side effects. In most cases, these side effects will go away within 2 to 3 weeks. However, these patients should continue to take their prescribed medications until symptoms have disappeared or until they are stable, and then the doctor will decide whether or not a new course of action needs to be considered for them. When side effects have not gone away in the past, they can become more serious over time. The most common of these side effects are nausea, vomiting, weight gain, headache, dizziness or fatigue. These are the same effects as if a patient had consumed an unmedicated or over-the-counter drug for the first few days, which could increase the risk of developing cancer if this drug is continued without further medical supervision for a longer period of time. In the early stages of breast cancer, the most effective and safest treatment of this type of cancer can be given by a breast surgeon.